we get into this concept of biofilms a lot. You guys are very familiar with this? So when you get sick, like you get a sinus infection, you've got like a wind heat invasion that's entered the lungs into your sinuses, and you've got pain, you've got a lot of mucus, you go to your doctor and they give you an antibiotic. And man, that stuff works so well. It gets rid of this infection. You still have a lot of mucus left, but you feel a lot better. The pain's gone, right? Well, some of this bacteria is like, holy crap, all of my friends around me are dying and being obliterated. I'm going to cover myself in mucus and hide. This is a biofilm. The most basic sense, look at your teeth. The tartar on your teeth is a form of a biofilm. So the antibiotic's done, your body's natural inflammatory response has stopped, the coast is clear, they shed their biofilm and they can come out and proliferate again. And then how many of your patients with conditions like this have chronic sinus infections? Over and over again, right? And they get the sinus infection and afterwards they've got nothing but mucus, right? So these microorganisms will hide themselves in there. Bacteria, viruses, fungi. Why is this important? Because biofilms are now implicated in basically every chronic major disease out there, from obesity to diabetes, multiple sclerosis, Parkinson's disease, you name it. In this stage, pain will come when the immune system perceives a pathogen, potentially relating to biofilms. It will increase cytokines, homocysteine levels, nitric oxide, aka we're getting an inflammatory response here. When NO is too high, when nitric oxide is too high, it will lead to muscle contraction, muscle stiffness, tension, right? Wind in the muscles. And this will also lessen lymphatic drainage, which is a huge issue in a lot of autoimmune disease, and especially fibromyalgia syndrome. Pain will wander in response to non-specific immunity, attempting to respond to the pathogen. This is wind right here. Non-specific immunity. So it appears that the pain is wandering from one place to the next. Have you all ever had like a wind invasion in your neck? And then you go, like a keen acupuncturist, you go and you try to treat it, and then it pops into a different muscle. This happened to me a couple of years ago, and I'm thinking like, oh, I slept wrong, right? And I'm like needling myself, oh, that feels better. And then it moved to the opposite side of my neck. And then somebody else treated me, and then it moved into a different muscle. And it would go from like levator to like supraspinatus, and then it would pop to the other side. I'm like, this is insane. I'm like, wait a minute, I have a wind invasion. And of course, you don't recognize it in yourself as easily as you do your patients, right? You feel a little foolish after a while. But it's extraordinarily painful. And then frustrating, because it's like, oh, yeah, massage right there, that's where it is, and then it's just somewhere else later on. You didn't actually get rid of it, right? You probably moved nitric oxide enough to where the muscle would relax. So in this state, the body cannot deal with temperature fluctuations without increasing inflammation. In a healthy individual, this is a good thing. But temperature fluctuates, maybe barometric pressure change, a weather front comes through, and then pain flares up. This is wind, cold, damp, B, or B jump. Stiffness in the neck and the upper back. Maybe frozen shoulder will come with this. Swollen lymph nodes, other signs of chronic inflammation. Wandering aches that will go from joint to joint and muscle to muscle. Allergy season will oftentimes make this pain worse. The temperature changes will make this worse. Skin itching is sometimes a part of this stage. Not always, but sometimes. Skin itching, skin sensitivity, that's important with fibro because they'll tell you that their skin hurts, their skin is sensitive. Our primary goals here, non-specific pains will go away, so no more wandering pain. This will usually mean decreased neck stiffness. Headaches often diminish or disappear, depending again, what is the pathology of the headache, of course. Decreased sensitivity to external factors. The dampness should start to leave, and you'll oftentimes notice that their energy starts to increase. Very often the allergies will get better or go away entirely. So that means their runny nose, their drippy nose, their postnasal drip. It's a good indicator too because sometimes their wandering pains are gone, but they're still sneezing, they're still sniffling, so you can still see these wind signs in them. Their eyes will get clearer. They will start to move better. Imagine MS patients and how they're not moving well.